Hello everyone, I am Dr. Rahul M. Rao, consultant psychiatrist from Mangalore, and today I am here to discuss about anxiety and how to handle it. So first and foremost, what is anxiety? In today's discussion, it's not about the anxiety that a student faces outside the exam hall, and it is not about the anxiety that an individual faces outside the room of a job interview. So the anxiety that I am going to talk to you about is something that is more persistent and comes in the way of an individual's day-to-day life and takes a lot of precedence than other activities or amidst other activities. Why should we know about anxiety? So, as per the American Psychiatric Association, among the list of most common psychiatric disorders, anxiety takes the first place, followed by depression. So you can imagine the number of people who are suffering from anxiety on a day-to-day basis and the extent to which it becomes troublesome. And the other reason is that it is something that is treatable with minimal interventions. So what are the symptoms of anxiety? I'd like to divide the symptoms of anxiety into physical symptoms and psychological symptoms. The psychological symptoms are the ones which occur in the mind. So the physical symptoms can be tremors, shaking of hands, excessive sweating, cold, clammy extremities, increase in heartbeat, hyperventilation, that is taking frequent and fast breaths. So coming to the psychological symptoms are more of what we call as impending doom. Something may happen to my loved ones, they might meet with an accident, or something may happen to me, I might die, or a sense of mind going blank. These are the psychological symptoms. And what are the different types of anxiety? So in a nutshell, if I have to tell you about the different types, there are these social anxiety where an individual avoids social gatherings, public speaking, or functions and other get-togethers. And there's something called as phobia, agoraphobia or claustrophobia, where an individual experiences this anxiety symptoms when they are out in the open, where there is no chance of safety, or when they are between four walls, say in the lift or a trial room. The other types of anxiety are panic disorder, which is spontaneous and abrupt symptoms that are both physical and psychological in nature, with a sense of impending doom, where they feel that they might instantaneously, something may happen to them, or they might die, they might suffer from a cardiac arrest. And the another entity is called as generalized anxiety disorder, GAD, which is more intense and pervasive because it is something like a free-floating anxiety that is always there irrespective of the environment. It is there right from the moment they wake up till they go back to sleep, and it can occur in different situations and contexts. Lastly, how to handle this anxiety? Of course, there are two main approaches that we use. When the anxiety is so severe, and in terms of severity level, I'd also like to say that when it is acute, when it is more immediate, we use certain medications called as clonazepam or lorazepam, where the anxiety reduces instantaneously. And for a long-term management of anxiety, we also suggest certain psychological techniques called as CBT, cognitive behavior therapy. And another useful, very simple technique is something close to the meditation or the relaxation technique. It's called as JPMR, Jacobson's Progressive Muscular Relaxation, where we suggest the patient to choose a calm and quiet room and focus only on deep and slow breathing with alternating muscular contraction and relaxation. To summarize, anxiety is something which is commonly seen in a lot of people around, although many of them do not report it, or they are unaware and they immediately rush to the casualty, the emergency room, or to a physician thinking that it's something to do with the physical symptoms. However, once everything is ruled out, the ECG and other investigations are normal, and there is some sort of a stressor going on, some sort of a difficulty around or in one's life, then these techniques which I mentioned will definitely come handy. So if you feel that you're suffering from anxiety, don't shy out from getting a psychiatric consultation. Follow the techniques I told you. Keep calm and keep that smile on. Thank you.